Medical correspondent Dr. Jon LaPook is here. He is affiliated with New York Presbyterian Hospital, where Secretary Clinton is being treated, but you are not involved in her treatment.
That's right.
John, thank you so much. Let me ask you, how serious do you think this is that they are keeping the secretary in the hospital for at least 48 hours?
Well, that depends on the answers to a lot of questions that we don't know, okay? So I am affiliated with Columbia. I haven't spoken to any of the doctors who are taking care of the secretary, but here are some of the things that are running through my head. It's unusual for somebody who's had a blow to the head to get blood thinners, and the reason is when somebody falls and hits their head, you're worried about bleeding into the skull, into the brain, like Natasha Richardson had. So the last thing you would want to do is thin their blood. So trying to figure out what could have happened here. She had some sort of concussion 2 to 3 weeks ago. She fell, she hit her head, and at that point they did I'm sure they did some kind of brain imaging, a CAT scan or an MRI of the head. At that point, she must have had either no bleeding or so little that they were able to observe her outside. Now, at some point, they're observing her closely. In the last few days, she either had symptoms or she had maybe a routine CAT scan, a routine MRI, and they saw a clot. Now, this clot would have to be inside the brain tissue in one of the blood vessels. So it's important because it's supplying the brain with nutrition. But we're not talking about one of the bleeding that Natasha Richardson had underneath the skull. So at that point, there's the reason to give anticoagulation, blood thinner, would be to prevent another clot from forming if you think she's at increased risk. The things that would give you an increased risk of bleeding would be, say, and again, I don't know about her case, an irregular heartbeat like atrial fibrillation, if she had some reason to have increased clotting, or if there was some damage to the blood vessels or swelling inside the brain that made an increased likelihood of having a blood clot. The last thing you would do, though, would be to give a blood thinner because you're afraid now of causing bleeding. So they're in a position where they have to decide, I want to give a blood thinner because I want to prevent further clotting, but also I don't want to give a blood thinner because I'm afraid that if she has some bleeding going on, she's hit her head. Normally, you would not give blood thinners for 3 months following somebody hitting their head.
Okay. One of the other things I saw in the statement from her spokesperson was that her doctors will assess her situation, including other issues associated with her concussion. And I think that's what has a lot of people very concerned about the secretary's health this morning is what other issues is she suffering from? We've not seen her in public since late November.
That's one of the cryptic lines in the press release that made me wonder, again, is it another issue that's putting her at increased risk of having another clot? Again, I'm thinking that they're between maybe a rock and a hard place where they want to thin her blood to prevent a further clot. On the other hand, they're afraid to give her blood thinners because that could increase bleeding in somebody who's smacked their head just recently. So they're going to, of course, observe her very closely in the hospital.
All right, lots of questions. Dr. Jon LaPook, thank you.